Hello and thanks so much for joining us for Healthline 3. I'm Jamie Ostroff, and today we are talking about prostate cancer. We're not only joined by Dr. Jonathan Henderson from Regional Urology, we're also joined by a patient, Earnest Hilliard, to get a first-hand account of not only battling prostate cancer, but how important it is to get diagnosed and screened properly. And remember, both of them are here to take your questions live on the air. You can submit your questions online by clicking on the Healthline 3 box halfway down the right side of your screen and just type in your question, or you can call us and speak to us live on the air. That number for you, 318-219-4569. We will be here taking your questions until 12:30. Thank you, both of you, for joining us today.
It's our pleasure.
All right, so let's start from the beginning. Tell us your story.
Okay, well, from the beginning, I would like to give God all the glory, because if it wasn't for God's grace, His mercy, and His love for me, I wouldn't be here. A little bit about me. I worked out for 30 years, ate right, did all the right stuff. I was real conscious of health. My father died from prostate cancer. So I was an advocate for prostate cancer. At my church, I would try to talk to the guys, hey guys, you need to get checked up, this, that. I always was trying to be a front runner for prostate cancer. I went to my doctor. I had been going to my doctor over 30-some years, okay? My doctor and he knew me, I knew him. He knew I worked out. He knew I didn't smoke, I didn't drink, I didn't use drugs. So that was all the candidate for a perfectly healthy person, okay? So probably about 10 years ago, 13 years ago, something like that, my doctor said, okay, what we'll do, we'll stop doing the full test for prostate cancer, because there's 2 phases to prostate testing. He said, we'll just do the blood. And I said, well, that's fine. I mean, he's the doctor, he knows best. So with doing the blood, somewhere along the line, prostate cancer developed. And because they wasn't doing the second part of the test, it wasn't detected.
No, the second part's no fun.
The second part is always no fun.
Is that the turn your head and cough?
That's
it's a rectal exam.
Okay. Yeah, and that's what most men that's what frightens them from the test for prostate cancer. So as time went on, I had began to get up frequently through the night, use the bathroom, and I'm saying that this is not right. So of course I do research and I look it up, and they say as you get older, you're going to do that. You're going to get up more because the prostate, it gets enlarged as you get older. So I said, that's fine. So I let it roll on and roll on. Well, as time went on again, it started burning when I would go to the bathroom. So I probably, like men do, I procrastinated. Well, it's probably a bladder infection. I'm going to put it off. And I put it off, and till it got to the point, I told my doctor about it. He says, well, what we'll do is we'll give you a little cream to put on it, and hopefully it'll be okay. Well, of course, now I let that go another year. Believe it or not, a year before I, because men generally don't like to go to the doctor. I mean, let's lay it out there. We don't like to go to the doctor. So I put it off, and it was burning, and it got to the point, I said, well, I need to really get this checked. So one of my church members, which works for the urology clinic, Colonel Wiley, I'm the church administrator at the church, so everything coming to the church, I have to sign off on it. So she comes to me and she says, Brother Hilliard, my boss want to have a seminar here at the church, prostate. And of course that was right with something. I said, yeah, let's do that, let's do that. So he come in, and like I do, I went to him. I always get there early, and he and I talked, and he was sharing some new techniques and new technology that they have for treating prostate cancer, and it intrigued me. I'm sitting there and I'm like, okay. So he did his seminar, and I shared with him. I said, well, I'm gonna come see you. He said, yeah, make an appointment. So I did not. This was in October.
Of last year?
Of 2015.
2015.
No, yeah, 2016.
Okay.
I did not make the appointment to January. Procrastinating, what men do, okay? And make the appointment. Of course, when I made the appointment, I couldn't get in until I think in February. Well, when I go in, of course, Dr. Nobles remembers me, and I go in, and he goes, hey, how you doing? And we talk a little bit. He says, we're going to do the blood. And I said, yeah, I know that. He says, well, you know we got to do the other part. And I said, I know that comes with it. So he do the blood. He come back. He says, it's a little bit high, but we got to do the other part. That will actually tell me what's going on. So when he did the rectum part, he says, we need to get a biopsy. He says, Mr. Hilliard, your prostate feels like a pineapple. And I said, okay. Of course, I had no idea how it felt anyway, you know, so I said, okay. So we do the biopsy, and he comes back, I'm thinking a couple of weeks, and my wife and I, we go in, and he says to me, he says, Mr. Hilliard, you have cancer. And of course, my wife started crying, you know, automatically, because she loves me, you know, and I said—
It's hard to hear those words.
It's hard to hear, but, you know, the Lord had already prepared me. I didn't share it with her, but I had already knew that it was cancer, but God said he had it, so I didn't worry about it. So he said that, and I said, okay. And my wife started crying, and I said, baby, I said, don't do that. I said, God got this, okay? So he says, we're going to set you up to see Dr. Henderson, which he's the surgeon that takes the prostate out. And of course, you have to, when you do that, you have to go through some classes to learn how to focus your urine when you pee and that kind of stuff. So went through those classes. Well, the whole time that this was going on, I was actually thinking in my mind— now I'm the church administrator, so I'm thinking in my mind, how, because they were talked about wearing a catheter, and I'm thinking, now, how can I go to church with a catheter under my pants? Now, the man had told me I had cancer, but I'm thinking about how I could hide the catheter.
Right.
See, that's what God had to break me from with that pride thing, you see, and I'll get to that. But so we go and go in, set it up for surgery, and I set it up for surgery because I'm off on Fridays. I set it up for surgery. Okay, I said, I think they said 7 days and you will be back again. So I set it up for Friday, Saturday, Sunday. Okay, I'm off. Monday, maybe 2 days. I'd have to go in and hide it. I'm good. So set it up, met Dr. Henderson. He shared with me. Daniel, his assistant, comes in. Awesome guy, awesome. Both Daniel and Dr. Henderson are, and I share with them all the time, they are ministers for God. That's what they do. Yes, God gave them the talent and the ability to do what they do, but they're just awesome. Daniel's come in, he talked to my wife, and he kind of broke the ice, made us feel comfortable. He said, here's my number. If you ever need me, call me. We said, okay. Set it up for the surgery, go in, and I wake up after surgery, and my wife is sitting by me, and I said, baby, they got it, they got it. And she looked at me with a solemn face, and she says, no. I said, huh? She said, no. She says, Dr. Henderson wants you to come into his office tomorrow. Now, that was Dr. Henderson's off day. He said, he wants you to come into his office tomorrow. And I said, okay. He said, she says to me, baby, it was a stage 4. Now, when most people hear stage 4, that's death sentence, you know, because normally people, from what I understand, people don't make it from stage 4. So I said, okay, so we go in. Dr. Henderson is in there, and he's talking. And Dr. Henderson said, Mr. Hilliard, your prostate was an advanced prostate. And I'm saying, okay, I'm still not grasping the fullness of what was going on with me. And I looked at Dr. Henderson, and I said, Dr. Henderson, I said, how bad was it? So he was sitting on the counter, and he hit the counter. He said it was this, just like I would hit this table. He said it was this hard. He says, if I had tried to finish with the robotics to take your prostate out, you would have had a permanent catheter and a permanent colostomy bag for the rest of your life. He says, I couldn't see doing a 61-year-old man like that. He says to me, he says, well, my wife had already shared with me that he left the room that night and went to church to pray because they was having Bible study, I think it was. and he went to pray for me. Awesome. God sent man. See, when I look back at this thing, I understand that God had already orchestrated everything. And the purpose I'm here is to witness what God can do. So I said, okay. He says, what we're going to do is we're going to set you up to go to Dr. Kim, which is the radiologist, which was right across the breezeway from them. And he says, we're going to set you up for Dr. Wan, which is the cancer doctor, and he'll start you on treatments because we could not take it out. And I said, okay. So we're walking across to Dr. Dewan's office. He set me up for Dr. Kim's office. And we were walking across the breezeway, and Dr. Henderson called my wife on her phone, and he says, I don't want him to go in 2 weeks. I want him to go next week to Dr. Dewan. So we go in and we talk to Dr. Kim, and he looks at the paperwork. Dr. Henderson speed escalated this thing so fast. When I got to Dr. Kim's office, he didn't even have my paperwork yet. He said, Mr. Hilliard, we don't have your paperwork, but Dr. Henderson is sending it over. Just sit down, and we start talking. And when he got the paperwork, he says, it looks rough, but he says, I think we'll be able to get it, I think. He says, I'm kind of on the positive side. I said, okay. So the next week, I go to Dr. Dewan and go into Dr. Dewan's office. And Dr. Dewan, awesome cancer scientist. And he has my stuff up on the screen, and he's looking at the x-rays and all of the stuff and information that he has. And he's talking how bad it was and how it spread, and my wife and I are sitting there, and my wife, looks at him because she's anxious of what's the cure for this thing, and she asks Dr. Dewan, she says, well, doctor, how long does he have? And Dr. Dewan says 12 months. Of course, she just broke down again and started crying. And I looked at Dr. Dewan. When he finished, I said, Dr. Dewan, I said, I thank you for your medicine. And I thank you for your knowledge. But I said, I'm leaning on God for my healing. And I told my wife, I said, baby, I said, God got this. He got this. Because I was trusting in the Lord. And sometimes when I talk about this, it becomes a reality again, so I get kind of. But I was trusted in the Lord from the very beginning because God had made some promises to his people that, he said, call on me and I will answer. He says, ask and it shall be given. You have not because you ask not. He promised that he would never leave me or forsake me. So that's what I was standing on. So started the process. Well, probably after my first treatment, I found out I was having excruciating pain in my back. And it got to the point that, oh my goodness, I was just bent over in pain. I couldn't hardly sit up. Called, I think it was on Mother's Day, I had my wife to call Daniel at the urology clinic, and Daniel said, bring him in. So I come in and found out that somewhere along the line that the tube that goes from my kidney to my bladder had come loose, and the urine was leaking in my body. So at that night, they put me in Highland, sent me straight to the hospital. Mm-hmm. Well, I go in Highland, and what they do is, now, you got to understand, when I first started talking to you, I said I was worried about one bag being on me. Right. Okay. Well, I go in Highland. I got a catheter in because they had to put a catheter in for urine. Go in Highland, and they say, well, what we have to do is we have to get that area dry so we can fix that part on that tube. So they ran a tube through my body and put a bag hanging out from the front. So now I got 2 bags, okay? Mm-hmm. So that's a surgery. That's my first surgery. So they come in my room the next day and they said, well, Mr. Hilliard, that did not clear the problem up. He says, what we got to do is tomorrow we're going to take you in surgery again, and we got to run another bag. So they put a hole in my back, and they hung a bag out there. So now I have a bag hanging out the back. I have a catheter in, and I have a bag on the front. Now you got to remember, I said I was worried about one bag.
And now 3.
Now I got 3 bags. So I said that to say I was trying to cheat God in a way of the blessing that was down the road for me, the testimony. Because see, if you never have a problem, how would you know God could solve it? So he allowed me to wear 3 bags. And my thing was, the 1 bag, I was trying to hide it, but he fixed it so the 3 bags, I was telling everybody about the goodness and the grace of God and what he could do. I would stand at my church on Sundays and I would say how good God is, in spite of what it looked like. I had the bags hanging on me and they were working, and mind you, I still had, I think, 7 more chemos to do. But I had the bags.
And still going to church.
And still going to church. Still going to church. I had to go because I knew that's where my strength was coming from. I think that lasted for about a month and a half. Now you're talking about some humbling and humility moments. When you get in the shower and you got to hang 1 bag on the rail and your wife have to stand outside of the shower and hold the other 2 so you can take a shower. That was a humility situation. But I realized as I look back, God had to break me so he can use me. See, when you think too highly of yourself, even though you don't say it, God knows your heart. So he had to bring me down to let me see what wearing 3 bags would feel like. Then I can testify, God, you brought me. You said you would, and you did. So that went on for about, I think it was about 2.5 months, maybe a month and a half or something like that.
So where does that put us now? Last year?
Yeah, that was last year. And when they released, I was in the hospital for 5 days. And when they released me out of the hospital, of course, my chemo started back. Now, I got bags on me, but I still have to do chemo. So through the whole time of doing chemo with the bags, my wife and I, at night, we developed Bible study with each other. And we would go into God's word, and we would read where God is a healer, if you believe. You know, I think it's in Matthew chapter 20, around about verse 9, where it was 2 blind men sitting on the side of the road, and they were blind, and they were crying out because they heard Jesus coming, and they were crying out, Lord, heal us. And the crowd tried to quiet them down. Same thing that I tried to do. I tried to be quiet about it. And they say, Lord, have mercy on us. So Jesus heard them. And he walks over and he says, well, what do you want me to do? And they said, make us see. So when he touched their eyes and they could see, the word of God say, and they followed him from that point on. So that's my mission now. Back to my story.
Yes.
Just had to throw that in. So I did my chemo, and every time I would go into Dr. DeWan's office, he would telling me the process, Mr. Hilliard, is looking okay, but we got a long way to go. And I said, Dr. DeWan, I said, I understand that. But I know God got the answer. God is my healer. And I appreciate the medicine. I appreciate everything because God has you as an instrument giving this to me. But God is the ultimate healer. When I got on to about my 5th treatment, Dr. DeWan walks in and he has this little smile on his face. And he said, Mr. Hilliard, he says, you're doing good. He says, I don't know what to say. I said, Dr. DeWan, God has already spoken. Went through the final treatment, through my radiation. Radiation was, Dr. Kim is awesome. We used to sit and discuss the powers and the abilities of God, if you believe. And went through that. Well, when I go back to do my final scan at Dr. DeWan, he said, Mr. Hilliard, your PSA is .00000.
What is a PSA for those who are watching?
PSA is what, when they do the blood, that's how they calculate your prostate level. Am I correct, doctor?
It stands for prostate-specific antigen.
Yeah.
It's a blood test that we use to determine if there's a possibility if a man has cancer in a screening background, so like before you get diagnosed. But after you're treated for prostate cancer, it's a very precise measurement of how well you responded to the treatment. So to have a PSA of 0 means there's virtually no evidence of cancer. And that's the term we use, no evidence of disease.
Yeah.
So you responded very well.
Very. God responded very well to my trust and belief in him. You know, I thank Dr. Henderson, awesome man, praying man. I thank God for putting him in my life. I thank Daniel. I thank Dr. DeWan, Dr. Kim, all of the staff at the urology clinic. But most of all, I thank God for hearing and answering prayer.
We've got to fill some holes in here, though.
Okay.
Okay.
Right? This
And that's where you come in.
Yeah, this urine leak he had. Well, this cancer had gotten outside the prostate, into the bladder, into the tube, the ureter that connects the kidney to the bladder. And what happened after his first treatment, the very first treatment, that cancer dissolved. And as it dissolved, it fell away from those areas that had invaded in the bladder and the ureter, and there became a hole to allow urine to leak out. So what looked like a bad complication was actually just a wonderful response to the chemotherapy.
Oh, really?
Yeah.
Okay. And yeah, when your body rids itself, it comes out, or rids itself of things like that, it comes out through the urine.
Well,
Correct.
the cancer was surrounding these structures that hold urine in. And so as they just quickly melted, the cancer died, and there was nothing there to hold the urine in any longer. It's just a hole in the wall.
Yeah.
So when you can sit here with us and hear a story like this, knowing you played such a key role, in addition to, of course, everything else and, the other factors at play, how does that make you feel, knowing that Ernest was able to beat his cancer?
Blessed. Just to be able to stand by and see something like this and to be part of it. But, as he said, statistically speaking, he shouldn't be here. And he is still today, 2 years into this, without any evidence of cancer. And it's really amazing. How could anybody not be a part of this or even hear about this and not have your hair stand up and be really intrigued?
Absolutely. And how does this speak to the importance of, like you were talking about your pride earlier of not wanting to go to the doctor and not getting screened? How does that speak to the importance of being more proactive about your health?
Well, I can't put it no other way than it's so important. If anybody heard what I just said and have any type of symptoms, I recommend that they would go to their doctor, go to their urologist, and get the blood and the rectum part of the exam. I didn't have a problem with the rectum part of the exam. My doctor stopped it because I was so healthy. And I think the system is saying that blood will detect any problem. So I can't stress it enough. I did some research and statistically, they say I think 70% of men would have prostate cancer. 60% of black men would have prostate cancer. I asked Dr. DeWan when I was in his office why so much as black men, and he had said something about that testosterone that we genetically have in our bodies. So as black men, all men, but as black men, we definitely need to get on board of getting ourselves checked. And it's important.
Well, in the United States, all men have a 1 in 6 chance of developing prostate cancer. Really high. black men have about a 1 in 3 chance in the United States. And I should be specific, it's African American, so blacks in the rest of the world don't have that same rate. So there's a lot of genetics that we don't understand about this, but not only do they have a higher chance of getting cancer, but they virtually always have a higher, more aggressive, a higher grade of cancer, and is presented at a higher stage. So it's very important that the message gets out that people really need to be screened by both things. And the other part of his story that I want to highlight is that his PSA was normal. So his blood test showed no indication to have a rectal exam if you're not following guidelines that say you have to do both. So strictly by the blood test, you would assume that there's not a problem. His cancer wasn't making that specific protein, the PSA protein. So his blood test didn't show it. It was a mutant cancer, but it was really obvious on the exam. And so a man really has to have both the PSA and the rectal exam.
It sounds like that should really be part of a routine physical.
It should be.
For men.
And that's what the guidelines say to do. But nevertheless, whether it's a physician not wanting to do the exam or a patient not wanting to do the rectal exam, look, I can tell you as a physician, I don't want to do it any more than you want to have it. But it's what we have to do.
Yeah.
Sure. You know, and it sounds like, you know, it's something we hear quite often, but this is just kind of more living proof that cancer doesn't really discriminate, you know, among the healthy, the less healthy, you know, different ages, et cetera, different socioeconomic backgrounds.
Right.
And it sounds like you took very good care of yourself.
Yeah.
Are you still keeping up? I gotta ask.
Yes, I've started back working out. Of course, I had to build my energy back up, build my strength. I don't go in the gym and pump iron like I used to. That used to be my thing. But I started back riding my bike, running on the treadmill, that kind of stuff. Because I've always been health conscious. And matter of fact, when Dr. DeWarn released me, not released me, but when he finished his last scan, he says exercise is the key, you know, to keeping yourself going, keeping everything, you know, on tack of what's going on. Now, I failed to mention, I was one that didn't like to take pills. I was 61 years old and had never taken a pill, you know, and that was another thing that I was proud of. Through this process, I used to take pills every 2 hours. I had pills to take. I have gone for Dr. DeWarn's office to my cancer doctor at 8:30 in the morning, and I get home at 4:30 that afternoon, because I leave his office and I have to go to Dr. Henderson's office. One thing I forgot too, Doc, is when I went to his office that morning, the first thing they did, they took and shot me in the stomach with 2 needles. That started the process. Now every 3 months, I have to go and I have to get a shot. Every day I have to take a pill called Zytiga. There's 4 of them. I have to take them every morning. So now I've gone from taking not anything to taking 4 pills, but yet I'm blessed and I'm thankful. You know, I thank God for the medicine. I thank God for allowing me to, it might sound weird, but I thank God for allowing me to go through this, because now I'm a better person. First of all, I know who He is. I know what He can do. And I know He's a promise keeper. He keeps His word. So with all that being in mind, I just praise God every day. I think David said, I will bless the Lord at all times. His praise shall continuously be in my mouth. And that's what I do every day.
That is a strong and fantastic message. And we've got a little under a minute left. So Dr. Henderson, tell us how people can reach you.
So at Regional Urology, our phone number is 683-0411. And I think it's important for every man from age 40 and up who is African American or has a family history to have both the PSA and the rectal exam on an annual basis. And other men who are not at high risk, no family history, and other races start at age 50 and do that once a year.
All right, and I'm sorry we could not get to our last call that came in at the last minute, but we'll be back for more health lines. It's always a pleasure having you guys here from Regional Urology here. That is all the time we have for now. Thank you for sharing your story. Stay well.
Thank you.